Pancreatitis. Question number 1. The nurse is caring for a client with acute pancreatitis. When asked by the client what will be happening during the client's scheduled ERCP, endoscopic retrograde cholangiopancreatography, the nurse responds that, go ahead and pause your screen and try your best to answer this question in about 60 seconds or less. Okay, let's break this question down, following the question breakdown strategy. So first, look at the key terms in the question: acute pancreatitis, ERCP, and the question's asking what will be happening during the procedure. So again, think of a few things you know about those key terms. So an ERCP is when a tube goes through the mouth into the pancreas via the bile duct to assess the organs. So let this big long name help you. Endoscopic means a scope, basically a tube with a camera. Retrograde means moving past. Cholangio is that bile duct. And pancreo refers to the pancreas. Ography is that video, or basically X-ray videography. So option A, the provider will laparoscopically remove the client's pancreas while the client is under general anesthesia. No, there's no cutting here or slicing the patient open, basically surgery. Laparoscopically means surgery. Now, option B, the provider will be using a combination of X-ray and guided endoscopy to assess the pancreas, gallbladder, and bile ducts. Yes, this is a guided scope into the pancreas, gallbladder, and bile ducts. Now, option C is incorrect. The provider will be using radiology to guide the removal of gallstones and the gallbladder. No, once again, no removal of gallbladder, we're only assessing here. And option D is also incorrect. The provider will be making a midline incision to remove any diseased part of the small intestine. No incision here and no surgical cuts here. Now moving on to question 2. Which is the most critical assessment finding in a client diagnosed with acute pancreatitis? So once again, pause the screen and try your best to answer this question. Now, following our question breakdown strategy, once again, first look at the key terms in the question here. So the most critical assessment finding, so just think what kills the patient the fastest, and always think the worst case scenario for pancreatitis. Now looking at our options. Option A, a bluish discoloration around the client's navel. Yes, this is a classic manifestation for Coulin's sign, basically bruising around the belly button, which can indicate bleeding under the skin from hemorrhagic pancreatitis. Now, option B is incorrect. Reports of mid-epigastric pain. No, this is incorrect because it's common and to be expected with pancreatitis. And option C is also incorrect. A blood glucose of 212. Now, this is technically elevated since normal glucose is 70 to 110, but this will not kill the client